I'm going to get started. Just got an opening karakia. Can everyone hear okay? Thank you. So we'll just open. Whakataka te hau ki te uru, whakataka te hau ki te tonga, kia mā kene ki uta, kia mā taratara ki tai, e hi aki ana te atakura, he tio, he huka, he hauhu, ti he Māori ora. Well, welcome everybody to the final NGO forum through HealthLink for the year. It's been a pretty long year, isn't it? And I was just working out today that it's 1 month and 4 days to Christmas. So everybody will be trying to tidy everything up so they can go on a bit of a holiday. And also we know there's often a lot more stresses at this time of the year as well. There's people thinking about money for Christmas presents and special food and things like that. So that can often bring challenges for you as NGOs. So I just want to acknowledge that. So we're going to start off today with the planning for the community health service space in Waitakere Hospital foyer. And that's going to be starting in February. And I think Ben's just going to share some guidelines that we got from Paula Seymour, that manages the hospital, recognising she's in charge of the space, and she wants to just slowly get into having NGOs sitting in the foyer and to see how that works. So, as we said, Waitakere HealthLink's working with Waitakere Hospital to initiate a pilot to establish a regular schedule of community health services to utilise the small area in the foyer, which is being upgraded at the moment. And we've had quite a bit of input as HealthLink into that, and we've asked consumers and NGOs what they think of that and how it can be designed. So there has been delays because there's been other frontline services and facilities that have sometimes had to take precedence to get on and finish those, which is understandable because we want our patients to be looked after first. But finally it's being done. So what Paula's wanting is that the area allocated will be limited to ensure there's minimal impact or negative impact on the staff and volunteers working in the foyer and patients transiting through the area, because we know it's a kind of a walk-through area that takes you to the rest of the hospital. So really there's going to be a schedule at the moment. There'll be a 10 to 12 slot and or a 1 to 3 slot. And at the moment, we want Paula's wanting it to just do once a fortnight to just try it. So basically it would be, I think she's only wanting one. Is that right, Tracy? She's only wanting one a fortnight for a little while to see how it goes. Tracy's had the conversation with Paula because Paula couldn't be here today, so she might just put me straight every now and then if I'm incorrect. But what she's saying is to be self-sufficient, so they won't really be supplying anything. So you may have a pull-up banner, have a collection of brochures with you. Freebies are a fantastic way of promoting your service, but please avoid lollies where possible, because we know that the hospital, the ex-DHB or Te Whatu Ora, now has a sort of a anti-sugar policy. But things like balloons and pens or notepads, things like that, things you think people might find useful that could have your brand on them or maybe information. It says, bring snacks in a water bottle. There's a water fountain near reception. So I think she wants you to be self-sufficient, but there is the cafe there too. But I'm sure none of you will starve for 2 hours. But, if you do need food, some people, need to eat regularly and small. And wear suitable clothing for the warm temperature inside the hospital. We know how warm it can be there and you don't want to be sweltering. So maybe just layers, if it's cold outside, a jacket you can take off and be comfortable. Can you just move that up a little bit now, Ben? It says parking can be an issue. Get dropped off wherever possible or allow plenty of time for parking. So it says park in the visitor, thank you. So I'm looking down at park in the visitor parking. Please don't use the patient parking. And follow directions of staff or volunteers. So there might be something going on. For example, and this is an extreme event, but last week, I think the week before, we had a patient coming in a ambulance, and he had a gun. And the whole thing went into lockdown. So we'd hope that we don't have extreme things like that. But if anything happens or there's an emergency, just follow the instructions, because everybody needs to be safe. So I'm not trying to put you off coming, but you never know what happens, because we're dealing with members of the community and they're all sorts. So there'll be a map of the foyer for a space allocated. Oh, I've got that going now. I've got my other computer now, so we might. Do you know how to? Sorry, I'm just going to do a bit of technical difficulty here. So you want to.
Oh, hi Tracy. We can't hear or see Linda. We cannot hear or see.
Sorry, how about that? That's better.
Oh yes, we are here. Okay, she's
I'm
here.
so sorry. So I'll go back to, oh, hang on, if you turn yours on. How's that? No. Let's turn your whole thing on. I don't know that you haven't. Right, we are a bit tricky today. So you probably missed the bit where I said what is going to happen is, at the moment, Paula wants to start this slowly next year. And there will be further information coming out, Tracy, when she'll let us know when this is going to start, who to contact, to put your name down for an opportunity. And hopefully over time it'll become more frequent than once a fortnight, because it's not really enough to get everybody having a turn for the year. So anyway, has anyone got any questions about this process, or have we got any hands up? Or just please, there's not a lot of us today, so please just sing out if you've got any questions. Doesn't look like it.
Can I just ask a question?
Nothing.
Hi.
Sure.
Hi,
Okay.
I'm Nikki from Te Ata. I haven't been to this meeting before because Tracy usually comes, Tracy Cannon.
Right.
So I missed the start because I had to download Zoom. Sorry about that. But I'm not sure what you're talking about at the moment.
Don't worry. So sorry, Nikki, we were up to is if you have the agenda there, yeah, and sorry, that was my issue too. I had to download a new Zoom, wanted me to upgrade, so it took a bit of time. So what we're talking about is we have the foyer of the hospital. Over many years and different iterations, there's been volunteers, there, a volunteer shop, etc., etc. They're upgrading the foyer, and there's going to be a program initiated by the site manager, Paula Seymour, where she is saying NGOs will get an opportunity to sit in the foyer for a couple of hours in the morning or a couple of hours in the afternoon. And firstly, once a fortnight, she wants to start it.
Oh, cool.
Because there's a bit of, we don't want conflict with space with the staff, visitors or patients coming through. And what we were talking about was the guidelines for that coming through.
Awesome.
So
thank you very much.
Where we're up to is, I think that's sort of setting it out. And either right towards the end of this year or early next year, we'll probably get the call out to say, put your hand up, you know, to put yourself in for a slot if you want to. And it's really an opportunity to visitors or patients going past or staff to understand what you do as NGOs, because as we know, I mean, you're really in that sort of primary healthcare space, really close to the community. And often secondary and tertiary hospitals, you know, it's really good for them to be able to refer when their patients are going out. So it's a bit more of a link between that secondary healthcare and primary healthcare. So that's that one. So what we're up to, and sorry, Nikki, I'm chair of HealthLink, just so Linda Cooper, sorry.
That's
so
okay, no worries.
Great, welcome. So we're up to our community health service provider presentation. So a lot of you have been here before, and for the ones that haven't, I think we've got sweet Louise here is new to the network, and that's Kate. What we're doing, I'll explain it again, but at the risk of being repetitive, a lot of you have done this before, is we give everybody an opportunity, 2 minutes today, to talk about your organisation. And if we can just have one person per organisation, we don't mind if 2 or 3 of you are sitting there or listening or on the call, that's fine. But just 2 minutes to talk about your organisation. You can put links in the chat, anything in the chat, and Tracy gets all that information and puts it on our website. It just means that it's available for longer. And if any of you see any synergies, sometimes you'll see a synergy and you'll think, gosh, we could work with that organisation, or I've got information, or I'd like information. You can just talk to each other. And that's the sort of beauty of, you know, it can set up for collaboration. Just want to welcome Mandy from Phil Twyford's office there. So we're going to start. So the first person is Denise from Disability Connect. Are you here, Denise? No. Actually, I'll tell you what, if you can put your virtual hands up for the long-term conditions, so Disability Connect, multiple sclerosis, Sweet Louise, and your Waitakere, and that way you come to the top of my page and can easily see you. So have we got multiple sclerosis, Luminita? No. Sweet Louise, Kate.
Yes.
Hello, Kate. Well, you're up first then. So you're new and you have to go first.
That's okay. Kia ora, everyone. Thank you for inviting us today. So Sweet Louise is a charity that supports men and women with advanced breast cancer. We are nationwide. We have over 800 members nationwide. And each area, I shouldn't say each area, because we have support coordinators that cover in the South Island some very vast areas. But the idea of our coordinators is that we connect with our members in each area. So we host member meetings where they can connect with each other. And we have a closed Facebook page where they can also connect with each other. As support coordinators, we contact our members regularly by phone, email, or we can home visit. We also link our members with other organisations. So it might be hospice, it might be Cancer Society or Breast Cancer Foundation for some counselling support. Social workers for financial support. Sweet Louise also has an annual voucher system to the value of $300 per annum per member, and the idea behind that is they can spend that on themselves. They can help fund things like, it might be massage, it might be transport, it might be meals, it could be anything that they want within our service provider list. We also provide our members with dependents under the age of 18 years with $300 worth of tamariki time per year, and that is to help make memories for our members. So we help them organise something fun, or meals, trips to the movies, whatever they want to do. And we also have a hardship fund, which, isn't widely known, but it is there in the background if we need that as well.
Thank you very much, Louise. That's great. Welcome to the network and all that information. So the next, and if you want to put anything, any links or anything you like in the chat bar for everybody to see, that's great. So next, have we got Jackie from Aotearoa? No. So now we have, where are we? Nikki back from Te Ata.
You can hear me?
Yes.
Yep, cool. So my name's Nikki Grant, and I'm currently the program lead at Te Ata. We are, I would describe us as a peer-led day program, servicing people with mental health and addictions. Sometimes our staff have lived experience of mental distress, and we have approximately 3 FTEs. So we've got 2 nearly full-times and then a number of part-time workers. We run a variety of different programs, including art and craft. So we've got needle felting, craft group. We've also got art on Mondays. And if anybody wants a program, actually, I can send it out. I'd have to get emails, but I'm not sure how to do the techie thing and put it up on the screen. Sorry. We have wellbeing groups like therapeutic movement. We've got some dance therapists that are training that come in and work with people. We have yoga as well. It's all run by voluntary staff, so it's amazing. Skill building, we've got cooking and barista training just started, which is really exciting. And some more support type groups like over 60s peer support group. We just started that, so that's another thing I could send out if anyone's interested. And men's group, and also a group that was designed by a psychiatrist, the Gift Box. You might have heard, some of you might have heard of that. That was Dr. Patty Randall, who also had personal experience of mental distress. So got lots of exciting things happening here. Yeah.
Thank you. That's
great.
great.
And also people can just come and play pool and table tennis and hang out and have a cuppa.
You just down the bottom of Keeling Road.
Yeah, 52 Keeling Road, Henderson.
Great work. Thank you.
Thank you.
All right. So we're now down to community health. If people can just, I think that's the rest of you anyway. So have we got Ian Ramos from Access Community Health? Is he there? Ian,
I'm here.
please,
Yeah.
your turn. Great. Welcome.
Hi, kia ora, everyone. My name is Ian Ramos. I'm the Kaimanaki, or Individualized Funding Navigator for Access Community Health. Yeah, so what I do basically is I help our tangata facilitate their individualized funding for them. Our other services are we provide support workers in the community to help with personal cares, home management, and respite. Yeah, so that's me.
Great. Thanks so much.
No worries.
Right. So have we got Redland from Aotearoa Africa Foundation? Not today. All good. Have we got our fetal alcohol spectrum disorder? Anna Gunderson? No, can't see. Looks like people have got busy today. And health and disability advocacy, Gabrielle. No.
Kia ora, kia ora.
Yes, I did see you. Oh, there you are. Hi.
Morena. Morena, everybody. I work for the Nationwide Health and Disability Advocacy Service, as the advocate for the North Shore Rodney area, and I'm covering Waitemata out west as well, because our lovely West Auckland advocate is on maternity leave. But our service provides free support for consumers with health and disability complaints. And so we support them through that process. And we have a contract with the Health and Disability Commissioner's Office to do the advocacy work, which is legislated. And the other part of our job that we do, as well as supporting people with complaints, we also network, which is why I'm here today on this talk today. And also we do free training with staff in health and disability services and with community groups. And that's a free training. And with community groups, we talk about the Code of Rights and what their rights are. And with health and disability providers, we talk about the Code of Rights, but also complaints, open disclosure, and informed consent. So we do about 4 topics, and those are all free. So that's essentially what our service is. Kia ora.
Thank you very much. That's great. I'm just being told my internet's unstable, so hopefully I'm all going to be okay. So I've just seen Red Redland arrive. So Red, your turn. Aotearoa Africa Foundation.
Kia ora. Sorry, my camera. Yeah, my camera and the light not so good. Yes, Aotearoa Africa Foundation is an organization that looks after African communities and ethnic communities. Currently, we have different ethnic groups, Africans and Afghans, also, as well as migrants from Sri Lanka. So we are a service-based organization where we provide food services, legal advice, as well as advocacy in terms of social housing and social welfare as well. So yes, and we run our programs like Fridays and weekends as well, and Saturdays. Yeah, that's a little bit of in general about what we do, and we love to connect as well, network with other organizations. And I'll drop the email in message box. Thank you.
Thank you. And have you still got your little shop on Railside Ave? Or you just got your... Are you still there, or is that a different African organization?
No, that's a different organization. That's African welfare. Welfare, so just by Railside Ave, yeah. It's a different.
Great. Okay, we're still helping the community, isn't it? But thank you very much. All right. So next we have, do we have Yasa from Kahui Tu Kaha?
Hi there. I'm attending on behalf of Yasser.
Hi, Sobia.
Kia ora, everyone. I am Sobia Zarar, and I am attending the meeting. We were supposed to attend, but Yasser just got into some other meeting, so I am just moved into Yasser's team, which is Muslim team. Basically, I'm a counselor. I am working for Kahui Tu Kaha counseling team also. Kahui Tu Kaha is a mental health and social housing organization. The head office is in Al-Azli, but we have got services across Auckland, social housing and other mental health services, which has got Aotearoa services, mainstream, then we have got refugee, and we have got Muslim services. The Maori specific cultural related services are also there. For our counseling service, we have got one office just next to the hospital in off Lincoln Road on Woodford Ave. We are contracted with NACPH or Green Cross, so we get the referrals from the GP for Muslim service. It's just Yasir has restructured the Muslim service, and we have got counselors there, and we have got support social worker to help the clients and the new referrals. We will assess the referrals according to their needs and then process them. But just for everyone's information, we have got like Arabic speaking referral, we have got diverse team. We have got a South Asian languages referral, counselor, and we have got AD specialist also. So our Muslim team is just in the process to start from a new contract. So please do send us if you have got any referrals anywhere in the hospital, other organizations, and we would like to work with everyone.
Thank you. That's great. Thank you, Sobia. Thanks for stepping in at the last minute. Now, Problem Gambling Foundation, I see Kotalo there. Are you going to be speaking for us?
Yep.
Great, thank you.
Thank you. So Tauwhalava everyone. My name is Kotalo. I'm the Kohiwa Health Promoter here for PGF Services, which is the Problem Gambling Foundation, covering Tamaki, Makaurau, Auckland. We are the only mainstream service supporting gambling harm minimization here in New Zealand. So we're a national service. We've got an office space here in Auckland and Newmarket. But other offices in New Zealand, in Hamilton, Wellington, and Christchurch. The space is quite small, so we do have other population-specific services because we have 4 priority populations in the space: Māori, Pacific, Asian, and Rangatahi. So we've got some kaupapa Māori services around New Zealand with gambling as a subcontract. We've got Mapumaya for Pacific, Asian family services for our Asian communities as well. And what we provide is free counseling for anyone affected by gambling harm. It doesn't have to be the gambler. It could also be someone who's affected by someone else's gambling. And so, yeah, just provide free counseling. And the other part of our role is public health, where we go out and do free public health workshops, education on gambling as an addiction, awareness around gambling harm, and tools for support. And we also have policy as well, and she supports gambling harm minimization policies at the local and central government level. And so, yeah, that's a little bit from me. Thank you so much, Linda, for the time.
Yep, bye, Lava. Okay, so next we have Sally from St John Hatahone. Hi, Sally.
Hi, thanks, Linda. Good evening, good morning, everyone. It sort of tells you about the time of year, doesn't it, Linda? Goodness me, it's been a busy time. Hey, for those that don't know me, my name's Sally Johnston, and I work for Hatahone St John, as Linda said, in the medical alarm division. So my role really, I cover the whole of half of Auckland and the whole of Northland, and provide information, education, and support for health professionals around our medical alarm services and how they can refer and the cost and how they work, but also some of those peripheral services that people may not know about that can help support patients in the community. So if you have a team of people that haven't heard me before, please get in touch and we can schedule a session for 2025. And otherwise I'm racing around doing my usual bit, Linda. Thank you very much, everyone. Have a wonderful Christmas.
Thanks very much, Sally. Thank you, that's lovely. So have we got anyone from Tupuna Manawa Health West? I've got Marie down here, but can't see you there. So if anyone else is coming in anyone's place, please do shout out. Okay, so next we have the Asian Network, Samuel. I saw Samuel there, he's also on our HealthLink board.
Thank you, Linda. Can you hear me properly?
Yes.
Yeah. Right. Kia ora koutou, good morning. I'm Samuel Cho, manager of Asian Network. We committed to the providing health promotion and social work service. I mainly is focusing on health promotion, providing health seminars and capacity building programs, and advocacy for Asian health outcomes. For example, the healthy baby, healthy future for South Asian moms and babies to provide education and information. And ours, the 5 weeks migrant woman well-being program that provides the basic local health information for new settlers, and afterward provide the 5 driving lesson to be for them to be more independently engaged with the events and communities. Also, still our social work teams work hard for Asian migrants who are in need. Please contact us if you have any client or the cultural and linguistic background needs more support. We'll have a look at what we can do for your client. And also our family violence teams provide a training opportunity to the organization and individuals. Please contact us if you need any kind of family violence prevention training. So we are now still working on the ethnic communities plan for the Upper Harbour local board and Devonport Takapuna local board to increase the ethnic communities engagement and build more inclusive community in the future. Thank you, Gabriel, for recommending the Jay, your colleague, to be part of the ethnic leaders circle for Devonport Takapuna local board, so that they can keep working on the plan that we provide to the local board. Yeah, thank you.
Thanks, Samuel. So now have we got Wendy here from Salvation Army, or anyone from Salvation Army? Don't see. That's okay. We know they do a great job. Now, is Ruth here from the Well Foundation, or anyone from the Well Foundation? Okay, well, we know that the Well Foundation is the fundraising foundation for both North Shore and Waitakere Hospital. So they raise funds to help with facilities, building, those sorts of things. So they usually give us an update. So we've actually come to the end of our NGOs. It's a short one today, but we do have 2 Te Whatu Ora Health New Zealand staff that want to present. So we've got, we have got Connie Zhang and Jyoti Mishra from Asian Patient Services. Still here? Yes, we have Jyoti. Hello.
Hi, Linda. Hi, thank you for the opportunity. So, tēnā koutou katoa. My name is Connie, and I got my colleague Chen here with me today as well. And we are both cultural support coordinator at Asian Health Service. So Asian Health Service is Asian ethnic specialized service in Te Whatu Ora, and currently managed by Waitemata. And we have 4 divisions. Asian Health Line, we have an 0800 number, that's 0800 888830, that providing nationwide service for free information and advice on New Zealand health and disability service, including national screenings, service enrollment and coordination, community service referral, coordination and health promotion. And we also have Asian patient support service, provides cultural and emotional support, assessment and coordination for Asian and ethnic and patients and families in Waitemata hospitals. We also have an Asian mental health service, provide cultural appropriate psychoeducation, life skills counseling, CBT therapies, cultural support, and psychoservice for Asian and ethnic mental health clients and their families. And we also, lastly, we have the WATIS service that providing the interpreting service, 24/7 free interpreting service for public hospital and primary health service in Waitemata region, that we cover over 142 language and dialects, including New Zealand Sign Language as well. And currently we delivering the Asian maternal mental health wellbeing project, the Healthy Mother and Healthy Future, in partnership with community NGOs. The project is aiming to support Asian mother and it access relevant mental health and support services. So we have our colleague Jyoti here with us. She is the coordinator for the project, and we will post our contact number on the chat box in a minute.
Thank you very much. And also it'd be really great if you could convince some of your Te Whatu Ora colleagues to come along to one of these forums and tell us what you're doing. And then I think for some of the NGOs, they kind of know who to link up with sometimes. So that'd be great. But thank you so much for that. It's great.
Thank you, Linda.
Okay, well, everybody, yeah, thank you. But thanks everybody for taking the time today. The next thing on the list is we have just an update, hospital update that we've had from Paula, because we're always interested in what's happening on the site. And we know that a few years ago, before the amalgamation of all the DHBs, there was a plan for this hospital, a big capital plan, and a lot of it got put on hold. And, you know, so reprioritizing, et cetera, because you've got one big venture and everything was measured against the priorities for the rest of the country. So we were a bit concerned that some of our things would drop off, but I'm pleased to say that we've been told that the capital plan for 17 projects on the Waitakere Hospital site has been approved and moving forward. So we haven't been forgotten, which is great. Our need is being heard. So I'll just go through a few of the bits and pieces that are happening. So the front of the house refurbishment will be completed by Christmas. That's what we were talking about, the foyer. The 30-bed ward and the ICU that will go alongside that, Manaki Hohonu, is going ahead, but it will cause a bit of disruption with connecting corridors and staff. But what that means is when we have an ICU, that means we then have the ability at this hospital to have some major surgery, because we'll have the ICU right there supporting if it's needed, which is a step up to being a full service hospital. Internal wayfinding is underway. So remember, we started with this community hospital with our different sea life and birds that you would see around the place directing you. So a whole new wayfinding is being developed now. They're currently decommissioning some of the buildings on the site because some of them are really way past their use by date and need to be moved for other projects. Utility works are being undertaken, so things like electricity, gas, all that sort of stuff. There are some financial constraints on the budget, which we've been told, because when these things are first designed or started, the estimates are X, and then over the 2 or 3 years, the construction costs go up massively. And then, of course, the money that's budgeted can't build it. So there are some issues. And one of those issues around the primary birthing unit, which we got the go-ahead for. The amount that was budgeted for that now is about 1 million short because of construction costs. So what they're doing, they're having a really good look at that. What can they change, etc., and still committed to doing that. It just will be a bit longer, unfortunately. But that is one of the projects which will be addressing our growth in birthing. So hopefully they're going to get that sorted out very soon, and we'll see some spades in the ground. But otherwise, that's all we've got for today. It's a short one, but we want to thank you for being part of this all year. It's really great. It's great for everybody to be updated what everybody's doing. We really appreciate you being part of it. I want to wish you all, I mean, it's a bit early, but we'll do it now because there isn't another NGO forum this year, but wish you really well for the holiday period. We all hope that all your families are well, and that you have a great break ready for next year, 2025. And as they say, stay alive till 2025 when we hope things will get a bit better. So thank you so much, everybody.
Sorry, Linda. It seems that Gabrielle have a question. She has.
Oh, sorry. I didn't see a hand up anywhere. Oh, it's in the chat, is it?
No, she's got a hand up.
Oh, sorry. I can't see the way I'm set up. Where are we? Gabrielle, please ask away. Sorry, I didn't see you.
On what you were saying, you know, these enhancements to Waitakere Hospital, and Is it actually the plan, the long-term goal, that it become a full service hospital?
Yep, that is the plan. And there was a plan, a 20-year plan before amalgamation, and that it had been approved by our Waitemata DHB, but then when the amalgamation happened, everything just was kind of off the table. It wasn't already contracted.
Right.
And we were a bit concerned about that, and we did make our voice heard around that. But we've been told by Paula, who is the site manager, that, yep, 17 have been approved for go-ahead. But the biggest thing, was last year was the birthing unit and the ICU and 30-bed medical ward attached to that. And that 30-bed medical ward with attached ICU means you then have the ability to do major operations here because you've got the backup if something goes wrong.
Yeah. Because
you can't have that here and then be transferred to North Shore because it's too dangerous. So that means, that's actually being built. Hopefully it'll be able to be funded and staffed and everything, but at least if it's there, we're on our way. And so I think that's really good. And I mean, I think this community has been fighting for that for decades, but it's been bit by bit by bit, we've been getting along. So yeah, I'm really pleased about that. And I think a lot of people will be to know that if you're having major surgery, you might not have to go to North Shore Hospital. You could come here.
Oh, that'd be huge.
Or if you had a bad accident, you could just go straight to theatre and have something here. I mean, it's not going to be everything all at once, but with the massive growth on this side, you look at the Red Hills development on the corner of Don Buck Road and Fred Taylor up by Westgate. That is 30,000 people when that's fully developed. Scott Point, Hobsonville Point, all of that, all the, intensive with the change in the housing rules, you can see it happening everywhere. So we'll have more people. We have a lot of need here, and a lot of people can't afford to be driving to North Shore Hospital. So that's kind of where we're at. Long answer, but gives you a bit of a background and hope for our future. That's
positive, yeah.
Okay, can't see any other questions, but all right, so just a bit of a karakia whakamutunga. Kia whakaare te tapu, kia wate ai te ara, kia tūru ki whakataha e, kia tūru ki whakataha e, haumi e, hui, ta, kia. And what that says is restrictions are moved aside so the pathway is clear to return to everyday activities. So we've gone back to Noah. So Merry Christmas, everybody. Happy holidays. Good health to you. Bye.
Thank you, Linda. Bye.
Thank you.
Bye.